Is considered as read. I reserve a point of order. The gentleman from Maryland is recognized for 5 minutes to explain his amendment.
Mr. Chairman, thank you. The purpose of the amendment is to make sure that the PBM reforms work as intended by increasing transparency around their business models. The amendment would require PBMs and health plans to disclose relevant information to federal employee health benefits program carriers, FEHB program carriers, as determined by OPM. OPM would determine which information would help the carriers negotiate the best healthcare coverage and prescription drug costs for federal employees and promulgate reporting requirements through the federal rulemaking process. Chairman Comer, I think you and I agree that if PBMs are working as intended, they serve an important role in negotiating lower drug costs and ensuring patients can get the medications they need. And I think we also agree that we have a drug affordability and accessibility crisis in the country, and the current way PBMs operate is playing a role in exacerbating it. But despite this committee's efforts to engage on the subject and hold substantive hearings, Congress and Americans still do not have a complete understanding of how PBM practices operate and how they may be contributing to high prescription drug costs and reduced accessibility to medication. I have in my possession a fact sheet from the sponsoring office, Representative Miller Meeks, of the Drug Act, and while I commend the legislative motivations behind the bill, it's unclear how much evidence there is to support claims that the bill will, quote, increase coverage of lower-cost alternatives, including generics and biosimilars, and generate savings for employers and plan sponsors. I share those goals, and I want to be sure that the bill will actually achieve them, but it's hard to be sure that the changes proposed will accomplish those objectives if the features of PBM operations remain shrouded in secrecy and darkness. Although we've heard that practices like rebate negotiation and spread pricing may increase costs for patients while enriching PBMs without an understanding of the remuneration PBMs may obtain from rebates, fees, and other discounts, and from practices like spread pricing, we don't have complete insight into the ways in which PBM practices may be a contributing factor of our drug affordability crisis. It's clear we need increased transparency within the PBM market to make sure Congress and the people understand the role they play in our very complex, needlessly complex healthcare system. With this understanding, Congress can enact more effective policy solutions. In fact, in a memo requested by the sponsor of this bill, Ellis Health Policy specifically said combining delinking, as this bill would do, along with greater transparency, which is the purpose of my amendment, we would be generating additional savings and reducing premiums. And this should be a bipartisan commitment. In fact, the Lower Costs, More Transparency Act that was passed by the House in December with bipartisan support included significant reporting requirements for health plans and PBMs meant to shed light on the inner workings of the PBMs. But that bill did not apply to the federal health benefits program. My amendment to this bill models the House-passed language in the Lower Costs, More Transparency Act and would require PBMs to report similar information to carriers that participate in the federal health benefits program as determined by OPM. For example, the Lower Costs, More Transparency Act requires PBMs to report information related to PBM spending on drugs dispensed to patients, the amount reimbursed by PBMs to pharmacies for dispensing those drugs, and the remuneration received by the PBM from drug manufacturers. By having a better understanding of PBM within the healthcare supply chain, FHB carriers will be better informed to ensure that patients will end up coming out on top. I urge my colleagues to support the amendment. I yield back to you, Mr. Chairman.